Hi, I'm Vic Senese, and this is UroNurse News. Knowing a potential significant other's sexually transmitted disease status is considered essential these days. But is there more to worry about? Turns out, yes. Before you even kiss goodnight, you may want to think beyond romance and consider oral health. According to research from the University of Louisville, cavities and other infections can be transmitted through the saliva, just like colds and the flu. Some experts estimate that up to 500 different germs can be passed in a single kiss. The mouth is home to countless bacteria and viruses. That includes organisms responsible for tooth decay, gum disease, and infections. And the major culprit is a bacteria called Streptococcus mutans. Smooch that one. This bacteria thrives in sugary environments and plays a major role in cavities. Kissing someone with a high level of cavity-causing bacteria or active gum disease can introduce those bacteria to the partner. And if the recipient already has poor oral hygiene, oh boy, a risk of cavities or gum disease increases significantly. Now let's break down 5 specific diseases you can catch from kissing. Periodontitis. It's a serious form of gum disease. According to the Journal of American Dental Association, it can be passed between parents and children and between intimate partners. The bacteria responsible live in periodontal pockets of the gum, but they don't stay there. They can be found on the tongue, the teeth, oral tissues, and in saliva. That means they can spread through intimate kissing, sharing utensils, food, or even toothbrushes. Who does that? Oh well, good oral hygiene matters, not just for you, but for those you want to kiss. Oral herpes, commonly known as cold sores or fever blisters, is extremely common. More than 50% of U.S. adults carry the virus. Doesn't mean you see it, but you carry it. Transmission happens through direct contact with infected skin or mucous membranes, even when sores aren't visible. Once contracted, the virus stays in the body for life. And here's an important point. Herpes simplex 1, oral herpes, can cause, drumroll, genital herpes. Yes. Experts estimate over 20% of new genital herpes cases are now linked to oral transmission. Number 3, syphilis. Yes, syphilis is a highly infectious, sexually transmitted disease. It usually spreads through sexual contact, but it can be transmitted through kissing, especially if the sores are present in or around the mouth. Now, while kissing isn't a common route, syphilis rates are currently rising according to the CDC. Good news, syphilis is treatable with doctor-prescribed antibiotics when caught early. Number 4, strep throat. Yes, that sore throat you might get. Strep throat bacteria are extremely contagious. They spread through airborne droplets from coughing, sneezing, breathing, and of course, kissing. Anytime saliva is exchanged, bacteria can travel. That's why dental experts recommend daily brushing, flossing, and routine dental visits to reduce bacterial load in the mouth. Number 5, mumps. Mumps? Yes, it's a viral infection that affects the salivary glands, causing painful swelling. It spreads through droplets from the nose or throat of an infected person. Thanks to vaccinations, mumps is far less common today, but outbreaks still occur in unvaccinated populations. Symptoms include fever, headaches, muscle aches, fatigue, and loss of appetite. Recovery usually takes about 2 weeks, and treatment focuses on symptomatic relief. Now, don't let this scare you away from kissing. Here's the reassuring news. Most people have strong natural immune defenses. And bacteria are actually more likely to thrive in a dry mouth than a healthy one. If you or your partner have gum disease, extra care matters, especially around infants, older adults, and those with compromised immune system. Good oral hygiene protects everyone. That means brush your teeth, floss, and see your dentist so you can kiss anyone you want. Can treating phimosis in infant boys actually reduce the risk of recurrent urinary tract infections? Tomorrow on UroNurse News, I'm going to break down a systematic review examining the evidence behind phimosis treatment and UTI prevention in infant males. We'll explore what the research says about phimosis and urinary tract infection risk. conservative management versus topical steroids versus circumcision, what urology nurses and clinicians should know when counseling families. If you care for pediatric patients or educate patients about foreskin care, like most of us in urology do, this is an episode you won't want to miss. Hey, join us tonight on Dr. Jeff Talks About Sex and Intimacy. It's been a full year of honest conversations, real questions, and expert insights. And tonight, we're celebrating it all. Join Dr. Jeff Albo as we look back at a year of sex and intimacy, highlighting the most powerful, surprising, and meaningful discussions that help patients and partners talk openly about intimacy, connection, and sexual health. From breaking taboos to answering the questions people are afraid to ask, this special episode brings together the best moments, biggest takeaways, and why these conversations matter more than ever. Tonight's episode is one you won't want to miss. Real talk, trusted expertise, real-life intimacy. Hey, I'll be on it live too, along with Dr. Susan Kellogg. So join all of us on Dr. Jeff Talks About Sex and Intimacy at drjeffsextalk.com. For UroNurse News, I'm Vic Senese. Don't forget to like and subscribe.
UroNurse News, we've got the scoop, helping you stay in the healthcare loop. From Monday to Friday, we bring the view.